Did you know that how well you keep your braces clean has a huge effect on the results of your orthodontic treatment? In this video, we will cover why it's important to keep your braces clean, as well as go over steps on how to brush and floss properly so you can have the best treatment results possible. Have you ever looked at an orthodontic bracket up close? There are a lot of places where food and plaque can stick to as opposed to the smooth surface of your tooth. Plaque is a sticky film that contains bacteria, saliva, and food particles. Some bacteria are good, but if you don't clean your tooth, more and more bad and harmful bacteria will get trapped. This bad bacteria makes acid from the sugars and starches in your food. Your enamel is the outer protective layer of your tooth, and it is the hardest substance in your body. It's even harder than bone. But if your enamel is continuously attacked by acid, it can break down through a process called demineralization, and a white spot can appear where the minerals have been lost, and this is one of the early signs of tooth decay. If severe enough, these white spots can remain forever even after your braces have been removed, leaving ugly white boxes on your teeth that are extremely noticeable and are permanent. Eventually, enamel will break down from the acid, forming a hole also known as a cavity. It's important to remember that just because you don't feel any pain, that doesn't mean you don't have a cavity. Some cavities won't cause you any discomfort until it's too late. Unfortunately, because your tooth can't regenerate or grow back, a dentist will need to drill out and remove the dead tissue and restore it to its original shape with an artificial filling material which is not as strong as your natural tooth structure. Imagine if you lost your hand or your foot. Obviously, you would be devastated because you can't grow them back, and it's the same with your tooth. If this hole or cavity grows large enough, it can enter the middle of the tooth, the pulp, which is where the nerves and the blood vessels are, and the tooth will die. When the pulp is attacked by bacteria, you may experience severe pain and discomfort. At this point, your tooth may need a root canal, a crown, or even worse, be extracted. One of the most common regrets I hear from older patients is that they wish they took care of their teeth better when they were younger. Imagine losing the majority or all of your teeth. It would be impossible for you to eat the things you love to eat, not to mention that dental work can be expensive. A single root canal and a crown can cost several $1,000s from a good dentist. So, if you want to save yourself some heartache, pain, and money, all it takes is less than 10 minutes a day. If plaque is left for too long on your tooth, it can harden as it combines with the minerals in your saliva and it becomes calculus. This calculus is impossible for you to remove at home with just toothbrush or floss, and you will need to see your dentist or hygienist for a deep cleaning. This calculus is full of bacteria and can smell bad and destroy your gums and bone around your teeth. This leads to the next consequence of not brushing properly: swollen gums, or what is known as
Gingivitis.
Because your body wants to fight the infection and bacteria on your tooth and gum line, it will bring in more blood flow to the area, which brings bacteria-fighting cells to the infection in a process known as inflammation. This is when your gums get swollen, painful, and dark red. Gums with severe gingivitis will bleed very easily because of the increased amount of blood in the gums. So have you ever noticed that when you brush or floss, you bleed and it's painful? That does not mean you should stop cleaning them. That means you are not cleaning them enough or properly. Teeth are held in your mouth by bone, and if gingivitis becomes severe enough, it will actually start to destroy the bone that holds your teeth in place. This condition is called periodontitis. Eventually, your teeth will get loose and have to be taken out or extracted. It can also hurt to chew. You may experience bad breath or halitosis. You will see receding gums and black triangles or spaces between your teeth. So, besides the fact that you can lose your teeth, why does this all matter? In terms of your orthodontic treatment, if you don't keep your braces, gums, and teeth clean, it makes it very difficult for your orthodontist to finish your case properly. I do absolutely everything in my power to give my patients the best results possible. But when I have a patient that doesn't do their part to keep their teeth clean, it puts a lot of pressure on me to remove the braces quickly because I can see the teeth and gums getting damaged. Sometimes we will leave the wires out for a month or two to give our patients an opportunity to build better hygiene habits, but this sets them back in treatment time. In extreme situations, I am forced to remove braces early because poor oral hygiene is severely damaging the teeth, and we unfortunately have to accept a less than ideal result. To put it simply, if you want the best bite and aesthetics from your orthodontic treatment, keep your teeth clean. There are 3 primary areas that you need to keep clean with your braces: the top, the middle, and the bottom. First, swish water in your mouth and through your teeth to remove some food particles and loosen them. Next, wet a soft bristle brush or electric toothbrush and apply the toothpaste. Start by gently brushing above your braces near the gum line. It is a very common misconception that you must brush hard to brush effectively. If you brush too hard, you can cause gum recession or break a bracket. Then, underneath the braces at a 45-degree angle, and make sure that the bristles are also going underneath the wire. Finally, brush your braces straight on. Don't forget to brush the chewing surfaces and the backs of your teeth as well. I suggest always following the same order when brushing so you can ensure you don't forget any areas. We recommend brushing at least twice a day after breakfast and dinner, but you can also brush after lunch if you want to keep your teeth extra clean. While you are initially learning to brush your teeth with braces, I would recommend brushing in front of the mirror and inspecting your teeth visually as you brush to confirm that you are actually removing the plaque on your teeth. Flossing with braces can be a bit tricky and time consuming, but it's extremely important. Imagine if you never washed your butt crack or your armpits when you showered. All the food you eat is rotting between your teeth for days, weeks, or months. If you'd like, you can use a floss threader to guide the floss easier underneath the wire. A handy trick is to tie the floss to the threader so you don't have to reinsert the floss for every single contact. Get your floss and thread it underneath the wire. Gently floss between each tooth, removing any trapped food particles and plaque. You can also buy super floss, which is like a floss that has a threader built in. A common mistake I see many people make when flossing is they simply go straight in and out. Your tooth has a rounded shape, so if you just go straight in and out, you are only cleaning one tiny part of your tooth. I recommend wrapping the floss around your tooth in a C shape and going down into the gum and pulling upwards 2 to 3 times. Don't go too far that you're giving yourself pain. This will take some practice to get good at and will take a while the first time you do it, but trust me, just be patient and you'll be a pro in no time. 2 great alternatives to flossing are using a water pick or platypus flossers, which can fit underneath the wire of your braces. I still don't think platypus flossers are as effective as regular floss because it isn't as easy to get that C shape I mentioned earlier, but it is better than not flossing at all. Make sure to clean between your teeth with any of the mentioned tools at least once a day, ideally before you go to bed. An interdental brush is optional but can be handy for getting between the brackets and wires and may be more useful in the beginning of your treatment when your teeth are more crooked. If you have an appliance that has been banded and cemented around a few of your teeth, it is extremely important to keep those clean as well by flossing and brushing, or the gums may become swollen and grow over the bands, making it extremely uncomfortable to remove. Remember to be gentle to avoid damaging your braces or hurting your gums. You must still see your general dentist for dental checkups and cleanings at least every 6 months. It is much easier for your general dentist or hygienist to clean your teeth if your wires are out. You can call your orthodontist office to schedule an appointment right before and right after your cleaning so that they can remove your wires before your cleaning and replace them afterwards. Brushing and flossing with braces is a bit more time consuming, but trust me, it is totally worth it to keep your gums and teeth nice and healthy throughout your orthodontic treatment. Trust me, it will be extremely disappointing if you have to get your braces off early with a less than ideal result, or if you have a bunch of holes or permanent stains on your teeth when you're finished. I tell all my patients to be patient, especially in the beginning. It will take time to build up this habit, but just take it one day at a time and eventually this will be a breeze, and you'll be able to clean your braces in under 10 minutes a day. If you have any questions or need more guidance, or if I missed anything, please let me know in the comments below or visit our website for more information. Thanks for watching, and if you found this video helpful, please give it a thumbs up, share it with someone who needs help keeping their braces clean, and subscribe for more tips on orthodontic care. We'll see you in the next video.